Okay, so Mrs. Dean, thank you so much again for allowing me to come to talk to you about the services and for you agreeing to them. Um, as I said over the phone, we look to help the families move through the adoption process a little smoother,
Mm-hmm.
to try to answer any questions that may come up in the process, and to see exactly where your case is and what we can do to help the family along the way, and
Okay.
to achieve permanency for little Faith.
Mm-hmm.
So, what does your CUA case manager? You said what is her name?
Jamila.
Okay, Jamila. And has she provided you with like phone numbers to reach her in case of emergency and things like that?
Yes.
Okay, and she's given you her supervisor's name and the agency information.
Yes.
Okay, that's good. And how often would you say that she comes to see you and Faith?
Once per month.
Okay. And when she comes out, does she ask you if like there's any issues or concerns that you're having with Faith?
Yes.
Okay. And how is Faith doing here in the home?
Overall, she's doing very well with her development and her. We're very bonded to her.
Mm-hmm.
Um, I just have concerns about her behavior lately.
Mm-hmm.
It's been like she's getting like really aggressive towards me and my husband. Sometimes her siblings, and it's just getting like more and more pronounced.
Okay.
She throws things sometimes. She kicks. She bites.
Mm-hmm.
She mostly hits you in the face,
Okay.
and it's like mostly when she can't have her way.
Now, okay, so she's two now, so they would call that like the terrible twos.
Mm-hmm.
Um, is she like in any services or anything right now?
She's getting early intervention services.
Okay.
It's called ITSE, and ITSE stands for Infant Toddler Social Emotional Services.
Oh, okay. And how often do they come out?
Once per week.
Oh, once a week. Okay. Have you like seen any changes in her behavior since they've been involved?
No, because we're trying to, well, the team is working towards pinpointing where her aggression is coming from.
Okay.
We suspect that it's coming from the visitation with her bio family twice per week.
Oh, so she's still having visits with the family,
Yes,
and they're twice a week.
yes,
Okay. So are these behaviors like after she has visits and she comes home, or?
yes. It's really difficult on visit days to get her to settle down.
Okay.
Um, Once she's upset, it takes a long time to calm her down,
Mhm.
and she has a hard time like self-soothing.
Okay.
Um, she's restless at times. She's clingy after the visits,
Mhm.
and I noticed that she wakes up in her sleep, kicking, saying like "Get off of me,"
Mhm.
or crying,
Mhm.
and sometimes she comes and get in our bed.
Okay. Wow, this sounds pretty traumatic. Now I
Hmm.
know she was placed due to traumatic events, um, but it sounds like you're really getting the hold of it here with her, and you're supplying her with the nurturing care that she sounds like she desperately needs.
Hmm.
So when she does have these outbursts, what do you do with her?
To try to get her to calm down, we will say, "What's wrong? Can
Hmm.
you use your words?
Okay.
Tell me what you want. I'm right here for you."
Hmm.
And trying to reassure her that whatever it is, we're trying to help her.
Hmm.
Um, Sometimes she will want something but can't really say the words of what she wants,
Okay.
and we're trying to understand her, and she gets frustrated
Hmm.
and just starts going off sometimes.
Okay. Have you ever tried to like tell her to take you to what it is that she wants or something?
Yes,
Okay. And do you find that working?
yes.
Okay.
And then sometimes she gets frustrated um, if we don't have something that she wants.
Oh, okay.
Like it's mostly candy. Like
Okay.
she want a lollipop,
Uh-huh.
and we don't have any lollipops, or it's past dinner time, and I don't want to give her a lollipop
Hmm.
because that will get her hyper,
Right.
and she doesn't understand that. She'll go off.
Okay. Okay. So how is she now? I heard you say that she hits, she bites, um, you and your husband. What about you said your the siblings as well?
Yes, they
Okay.
get it. At times, if she can't have her way, if they're right there,
Hmm.
she'll go up to them and just smack them.
Okay.
Um,
Now is are
or
these
pull their
behaviors?
hair.
Oh wow. Are these behaviors like in daycare as well?
No, the daycare, they pretty much say that her behavior is her behavior is not her behavior doesn't escalate to that level in daycare
Okay.
until recently. They said that she
Hmm.
had one incident where she bit another child,
Mm.
and other than that, they don't see what we see at home. Like they don't see the level of tantruming
Hmm.
and falling out and screaming and things like that.
Wow. Now has anyone else seen her tantrum and fall out like that? Like has the cool worker seen her in action or like
Yes,
her child advocate or anything like that?
not her child advocate, only her co-worker.
Okay. Did
She
they
told
offer
me
you like any suggestions or anything like that?
no, but
Okay.
they don't offer any like strategies on how I could help her with her behavior.
Okay.
They just want to basically report it to court.
Okay. Okay. So in the meantime, you're left with the brunt of just dealing with this little 2-year-old that's having tantrums. Okay.
Hmm.
So it does sound like what you are doing is sort of working. It just sounds like you it's going to take a lot of patience and determination. She sounds like she's a determined child,
Hmm.
and very stubborn. So how is her language skills and things of that nature? Does she get any speech therapy or anything like that?
No, for
Okay.
language, she didn't qualify for any services.
Hmm.
They said that her language is developing beyond her age range.
Oh, okay.
Um,
So she knows how to talk. She's just not using her words to express herself
when she's angry,
when she's
yes.
angry. Okay. Okay. So I know you are a pre-adoptive resource. So with her having all of these behaviors, are you still willing to go through with letting this be her forever home and letting this be her permanent residence?
Yes, because I think that the behaviors are coming from like her not being stable. Like the visits kind of interrupt her daily routine,
Okay.
and the worker, her early intervention worker, shared with me that even though the visits might be like 2 hours here and there, to her it seems like an eternity because they pick her up from the daycare,
Hmm.
take her to the agency for the visit. She's probably wondering, okay, well, am I going back or are they going to keep me here?
Hmm.
So when she do get home, she's like clingy, and sometimes she don't want us to leave the room, and
Hmm.
she wants us to carry her around the house. She just wants to be stable, like knowing that okay, if I go to daycare, I'm going to come back
Hmm.
home.
So it sounds like for her to be two, she's looking for stability.
Mhm.
So what I could offer is when you drop her off at daycare to let her know that you're coming back to
Mhm.
get her. You're going to pick her up from daycare and you're all going to go home.
Mhm.
I think you should start there. When she comes home after those visits with the biological family, I think what would also help is that you tell her when she leaves that you're going to come back and you're going to come and pick her up and bring her home as well. Then,
Mhm.
and also if she does get a little clingy or whatever, it's okay. She's two, to go ahead and just pick her up and try to coddle her or whatever because it feels. I agree with the other therapist that she may still be traumatized or have feelings of the traumatic events that happen, and she's probably probably is scared. Or am I going to go back with these people who harmed me or whatever, or am I going back to what did she call you? Did she call you mom and dad?
Yes.
Oh, okay. So she does feel that comfortability here. Okay. So yeah, I would still just continue to keep nurturing her and making sure that she feels safe here. Now, on the other aspect with court, what I would say is that we would need to look in to see just exactly why the cases continue to get continued. Now, in the meantime, since it is going through that, once determination does happen, sorry to tell you, but there may be additional social workers who may come to the home. But in the meantime, I'll still be on in case you have any questions regarding that. If you have any questions about what this person is supposed to do, what this person is supposed to do, you can call me at any time and we can hash that out to see. Because there's going to be, of course, your court case manager who's going to be here, the child advocate social worker. There may be an outcome specialist from KUA. There may be, a second chance. We'll have a social worker that'll come here. They have to come as well. I'm going to come as many times as you may need me to come to try to explain the procedure and the process of everything that's going on. And then you're going to get a DHS permanency worker. And that person will be coming to the home to meet with you to make sure all the paperwork is ready and ready to push on to the courts to finalize the adoption.
Okay.
So right now it seems like the main part is to do the termination of parental rights, and that's what they're working through now. I did read through the case a little bit. I didn't want to read too much, but it seems as though mom is still in her addiction. Father is still doing his what's being asked of him, but there's still a little shady situation with father regarding him completing his goals as well. So all we can do is just wait for this next court date and see where they're going to go from there. If the termination is going to definitely take place at this next listing, and then we can get a better grip as to what more needs to be done, because it seems like she's secure here. The home is approved, and it seems as though the family profile and child profiles have both been completed or either near completion. So I think that everything should, be worked out by this next court hearing. It's just like a wait and see as of right now. So I do understand that you may feel a little leery about all the social workers coming to your home, but there's a method to the madness. They all have specific jobs that they need to do. But if you have any questions and they're not answering them to your satisfaction, please reach out to me because I could try to help you through that. And also, if they have like any more meetings here or anything like that, let me know. I'll come pass and we can all be here at the same time. So no one's coming here Monday or Tuesday, back to back. We can all come at the same time. I mean, your time is valuable as well. And we definitely don't want to interrupt Faith's schedule either. So if that will work and you're willing to do that, I have no problem with, working out with you and the family.
Okay.
Okay? All right. Thank you.
Thank you.